Then tell the child to point to or touch the card with the E on it. If the child does not know the letter E, describe the symbol as a picture. It's not important that the child identify the symbol as an E, only that he be able to distinguish the card with the E from the blank card. With the cards behind your back or under the table, randomly change the position of the cards. Present the cards again, telling the child to again point to the E or picture. The cards may be held next to each other, on top of one another, or diagonally. Repeat this process at least 4 times. The test is complete when the child correctly selects the E card 4 times in a row out of a maximum 6 attempts. Mix up the presentation to avoid repetition. Here are some tips for conducting successful stereopsis screening. Watch the child's eyes to determine if he or she is looking at both cards before identifying the card with the stereogram. Sometimes a reminder to look at both cards must be stated each time the cards are presented. Some children respond very quickly, so the screener may not feel confident that the child saw the picture. Tell the child to slow down. Instruct him or her to look at both cards before pointing to the picture. Watch the child's eyes for signs that he or she is looking at both cards first. Asking the child to trace the picture can help give you a sense of whether he or she is guessing or truly sees the E, especially when screening very young children who do not yet recognize the symbol as the letter E. When understanding is demonstrated, proceed with testing. Show the child the model E card. Suggest that he or she touch the E on the model card to understand that the picture pops out. When understanding is achieved, proceed with testing. Without the glasses, use the back of the cards. Ask the child to point to or touch the E or picture. When it's clear the child understands the game, proceed with testing. The passing goal for the child is to be able to distinguish the E and identify the E card on 4 consecutive responses. The number of outcomes are possible. A child either passes the stereopsis screening or returns for rescreening. At the rescreening, the child either passes the stereopsis screening or is referred to an eye care professional for a complete eye examination. After a screening, a child may be referred for any of 3 reasons: ABCs, visual acuity, or stereopsis. A child should be referred for an eye examination based on the ABCs when concerns about the child's vision was expressed by parents and/or teachers. Signs of a vision problem was noted by a certified screener. A child should be referred for a possible visual acuity problem when a 3 to 5-year-old child could not read the 20/40 line with one or both eyes at the rescreening. A 6-year-old or older child could not read the 20/30 line with one or both eyes at the rescreening. A child should be referred for a possible stereopsis problem if he or she did not correctly identify the card with the E on 4 consecutive attempts out of approximately 6 at the rescreening. A child may be referred for failing any additional screening tests. It is also important to keep accurate records of the number of children that you screen and refer, and to report this data to Prevent Blindness Ohio on a regular basis using the Vision Screener recording form. The Vision Screener recording form also should be used to track whether or not each child who fails the screening has obtained the appropriate follow-up care from an eye care professional. Copies of the form can be downloaded from the Prevent Blindness Ohio website, www.pbohio.org, or www.wiseabouteyes.org. Or you can request additional copies by contacting Prevent Blindness Ohio at the above websites or at 1-800-301-2020.